Well, the BSH has been running now for about 60 years, and my involvement in the specialty has been really over the past 40 years. And I think the modern era in diagnosis and probably also the treatment of hematological malignancies began in the mid-1970s. And prior to that, there was a realization that there were different types of lymphoma and leukemia, but the only practical way of diagnosing them or separating them was based on looking down a microscope and distinguish between big cells and small cells and squiggly cells and round cells. But there was a realization there were different types of disease, and these had different clinical implications for the patient. And very strangely, possibly one of the underlying causes of a big change in diagnosis came from Richard Nixon, the President of the United States, who wanted to emulate his predecessors in the space program by curing cancer and put huge amounts of money into cancer research, which caused a step change in activity in the field. And very specifically in haematology, I think one of the key insights was understanding that hematological malignancies were lumps of tumour derived from a single cell. And that came from understanding the structure of the immunoglobulin molecule and studies of patients with myeloma. So this idea was that cells were monoclonal, and that was a radically new idea just before the 1970s. One thing which I was involved in at that time, which had an important implication, was the development of immunocytochemistry, which had existed in a sort of basic form for a long time, but there were some developments in the technical side of it which suddenly made it feasible to do as a clinical diagnostic test, albeit a very difficult and complicated and unreliable one at the beginning. So that actually provided a test where tumours could be distinguished between monoclonal and polyclonal proliferations based on their immunoglobulin secretion. So that was really a big step, as was the development of immunocytochemistry. But the other thing which happened in parallel with that was a sudden explosion in knowledge of immunology, which led to the realization that lymphomas in particular were actually tumours of the cells of the immune system. And so the understanding of the basic biology of the immune system then fed into a rather more sophisticated understanding and classification of lymphomas, and immunocytochemistry in turn provided the tools which allowed these classifications to actually be put into practice in everyday clinical work. There's a couple of developments in basic sciences around this time which really did have a very important influence in the future development of the specialty. And the first was the understanding of how normal lymph nodes work. And people had looked at the histology of lymph nodes for 100 years, and they'd almost completely ignored one of the most important features, which was a structure called a germinal centre. And researchers in Birmingham in particular, managed to unravel what was going on, and that was within germinal centres, cells are constantly mutating and changing their genome in order to make higher affinity antibodies. And that turned out to be an exceptionally pivotal step as well in the pathogenesis of lymphomas. And that again fed into the classification of lymphomas. The other thing which began to take shape at this time was understanding the basic underlying mechanisms of cancer. For about 100 years, well, less than 100 years, 50 or 60 years, there'd been work happening with tumour viruses, which led to the insight that cancers were caused by changes in genomes and in cells. And the second thing, particularly relevant to hematological malignancies, was the description of what's called the Philadelphia chromosome, which is a rearrangement of two chromosomes, chromosome 9 and 22, which was almost invariably present in chronic myeloid leukemia. And that was described by Janet Rowley in the States, and it became known as the Philadelphia chromosome, and was both a first genetic marker for hematological malignancies, but also in the end played a very key role in understanding the overall pathogenesis and biology of leukemia and lymphoma.